Hi, my name's Phil. I'd like to talk about politics. In this video, I'd like to discuss the very damaging revelations in a BBC Panorama programme this week that exposed just how poorly the government prepared for this pandemic, including the failure to order any of the essentials that we knew they were going to need. But first, if you'd like to be notified of daily news and politics, then please subscribe to the channel and click the bell notification icon. So, the British government keeps saying all the time that they have taken the right steps at the right time. Patently untrue and becoming more obvious by the day. But a Panorama programme, which happened a couple of days ago, I didn't watch it when it actually came out. Don't really watch telly, but I was watching it yesterday. And it reports on current affairs, and it released a programme this week on the BBC that exposed just how bad the government had been in preparing for the coronavirus pandemic. And if you're in the UK and you haven't seen it, I strongly advise that you do watch it. You'd be able to find it on the iPlayer. Outside the UK, it's probably trickier, but you may be able to Google some report on it or find some clips. Now, the programme included a lot of interviews with frontline medics bemoaning the lack of PPE. It also included interviews with experts who make it clear that not only did the government not order a single item of some of the necessary items of PPE months ago when they knew this was coming, but specifically that there was no excuse for it, because the government, even when they've had to admit that they didn't order things, have come up with excuses. They've made it clear there is actually no excuse for this. And no excuse means that you don't get to blame global demand, which is what the government are doing. I mean, I knew this anyway, just by looking at other countries. You know, if the global demand was the reason, then other countries would be in the same boat, but actually only a few other countries are, and those are other countries that also didn't take appropriate action. There are countries that are managing well enough, comparable countries as well. But it's good to hear that those who are really in the know saying that there was no reason why we shouldn't have had the supplies, because they would know. And some interviews were with medics showing the PPE that they'd been given. It includes, for example, the role of plastic aprons that I, as a science teacher, have used for minor practicals in a teaching laboratory when there haven't been lab coats available. They're not appropriate for medics. They don't cover you. In fact, you know, the doctor that was being doing a film of this, I should say, and was put on the programme, was actually saying it's the sort of thing you'd expect a dinner lady to wear. I think the nurse said the same thing. They don't cover you. They don't cover your neck or much of your torso. They don't cover your arms at all. They're flimsy plastic. Worthless, I think, was a term that was used, but they're basically of limited use only. They're not a replacement for a gown, which is what you're supposed to have. You know, they compared by showing the full PPE that should be worn when dealing with a COVID patient, a far cry from what is actually provided. The programme showed some of the ramshackle alternatives people have been using on the front line of the NHS because, well, they're better than nothing. You know, it includes things from DIY stores because it's better than nothing, but it's not the equipment that they should be provided with. But the key point that was made time and time again was that it's not adequate. So even some of the equipment that is being provided is not adequate. And as importantly, we could have had adequate stocks of this equipment if the government had have acted in time. And we're not talking about expecting the government to have overstocked before we knew about the need to do so, using that old hindsight, because that's what the government will try and do. Oh, it's amazing hindsight, isn't it? You know, because even when they have to say that, yes, we should have ordered more of this stuff sooner, it's amazing thing, hindsight, 2020 vision. No, we're not talking about a time before we knew it was coming. In fact, we've known this was coming for 10 years. We didn't take advantage of the extra time that we had, even when we knew it was coming for certain. We knew what it was when it was announced as a pandemic. We still had more time than a lot of other countries, and we didn't use that extra time to act compared with comparable nations. And some of the PPE supplied belatedly is not only not adequate, but some of the stuff that looks like it's the proper kit, at least, is out of date. Several doctors have shown photos of best before date stickers covering up one that gives the real best before date of several years ago. In other words, it shouldn't be in use now. This programme showed another example of it. And the programme made clear that a pandemic has been highlighted as the number one threat to the UK for a decade now. So the British government have known and have actually designated pandemic as the number one threat to the nation for a decade. So if the government didn't prepare for the number one threat to the nation, how much do you think they're preparing for the other lesser threats to the nation? And the government have tried to say that, oh, that's because we were expecting a flu outbreak, not a coronavirus one. And this is true. The World Health Organization had certainly been saying that the next big pandemic is very likely to be a flu pandemic. It's what the Cygnus exercise that was run by the British government a few years focused on as well, what we do in the event of a serious flu outbreak. But the fact is that what you need to deal with a serious flu pandemic is exactly the same as for this virus. Yes, there are things that would make it tricky. For example, testing kits and lack of vaccine, those things would still be an issue because this is not what we were expecting, granted. But in terms of the PPE needed, it's the same, exactly the same. And last year, before this outbreak even hit, the government were advised that gowns would be needed desperately. This was before we had the coronavirus. This is before it was even known about. None at all were bought, none of them. Government were advised we're going to need these things. Government bought none for the stockpile. And I don't mean they didn't buy enough. I mean literally zero. Zero were added to the stockpile. The programme interviewed a public health expert, John Ashton, who's an experienced regional director of public health and a doctor as well as a lecturer and academic in these matters. And in other words, someone who knows his stuff. And he was outraged that no gowns were bought and said that there was no excuse for this. He described the fact that no gowns at all were in stock as breathtaking. And I will remind you, this wasn't an administrative failure. Ministers were warned about this last year and there was no pressure on demand. They could have just ordered them, bought them, they'd have been delivered, no problem, well in advance before we even knew what pandemic we were getting ready for. They could have been added to the stockpile quickly and easily, just as they were advised to do. But they didn't. And it wasn't just gowns. There are other things we didn't order any of. Visors, swabs, body bags. Even when we knew the pandemic was coming, they did not order body bags. None of these were bought for the stockpile. And there's also an auditing problem in that, and this was completely new to me. Some of the things in the programme were not at all news to me. Some of them were, and it was much worse than even I realised. One serious issue I'd not come across, 33 million respirator masks. Now, these were added to this, or they were at least bought, or they were at least paid for, because I'm not sure what's going on now, and neither's the programme. So 33 million respirator masks were paid for. 12 million have been handed out, but we need much more. Well, there's another 21 million in stock. Can we have them, please? No. The government has refused to explain what has happened to the other 21 million that we're supposed to have. Where are they? Where are they? They should be in stock. They're not. They're not available. Now that's dodgy. That's really dodgy. Where are they? How do you lose 21 million respirators? Were they even bought in the first place? The government tried to say as well that it wasn't advised to buy some of this kit when they said, well, you didn't buy any of these pieces of kit. They said that they were not advised to do so. Now, I do not expect the Health Secretary or indeed any minister to know what we need to stockpile. Absolutely accept that they have to be advised what we need. And if they weren't advised, then no blame should fall on the ministers. It is a failure somewhere else in the line. However, it's not true. Not only were the government advised to buy certain things and add them to the stockpile last year by the government's own advisors, in February we were issued with recommendations for essential PPE in preparation for this pandemic when we knew that it was this pandemic that was coming, the coronavirus, by the ECDC, which is the European body for dealing with public health in the EU. And it said you need to get this equipment and you need to buy this much of it. Work was done for us. Ministers just needed to say, right, order this stuff. That was it. They didn't. Now again, was this more Brexit nonsense with the government ignoring anything that came from the EU, which we were still receiving this help as part of the transition period? Because if it is, then that's yet another example of how this Brexit mentality has killed people in this country out of nothing more than spite and political ideology. The programme went on to talk about British manufacturers producing equipment that is being exported because the British government gave them orders. Now, I have talked about this before. You know, one manufacturer, it was showing, was producing gowns that could have been supplied to our NHS. You know, they could have supplied what we needed. Instead, these gowns were being exported to the United States, they said. We didn't want them, even though we were running out. And some hospitals have since actually run out. They did say in the programme that they have now started to receive orders via private companies. So the government haven't been making these orders. They haven't been given the NHS to make orders themselves. This is from a private company that was intended to be used in this country, which, guess what that means? That means the government are effectively paying private contractors to order these things on their behalf, basically acting as middlemen when they could do it directly. So that's more of our taxpayer money going into private hands for profiteers, delaying the process of getting this to the NHS. So the bottom line is that despite the government lies, we had the time and resources to buy in the kit that we needed. The government were advised to do this long before there was any massive surge in global demand. We acted too late, and when we did act, we bought the wrong kit. So the government's argument that, well, the process is taking time because we have to make sure that the kit matches our specifications is also a lie, because a lot of what they're buying does not meet the specifications at all. We haven't been buying the right kit. It's not just that we've been buying the right kit and it's been delayed for that reason. So no, they don't get to use that as an excuse either. We haven't been taking the right steps at the right time. We have been desperately reacting. And when you react desperately, you abandon reason for urgency and haste. That is what happens, and that's what's been happening. The right steps at the right time would have been ordering equipment when they were told to. We didn't. People are dead. That's really all there is to it. And how are the government reacting to this criticism? Are they taking the correct action now, albeit belatedly? No, they just changed the guidance. They aren't changing the procurement to match the guidance. They're not looking at the guide, oh, they need this equipment, we haven't got it, we'd better order more in. They're changing the guidance to match the procurement. But the new guidance is not based on good practice. It's based on political expediency that doesn't value the lives of either NHS staff, their patients, or the wider public. Saying, for example, oh no, it's fine that these plastic aprons don't cover your arms. In actual fact, not having your arms covered is really good for hygiene. Yeah, okay. The only health that matters is the health of the Conservative Party's reputation. So I hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, then please also click the Patreon link for details. And until next time, I'll see you later.